Hi, my name is Dr. Ozan Toy. I am the Chief Medical Officer at Telepsychiatry. In this video, I just want to talk briefly about Welbutrin and specifically considering Welbutrin as a treatment for anxiety. What is Welbutrin? Welbutrin, which is the brand name for bupropion, which is the generic name for this antidepressant. And bupropion is kind of a unique antidepressant. We kind of consider it an atypical antidepressant. And that's because its mechanism of action is a little bit different from the standard SSRI or serotonin reuptake inhibitor antidepressants. Wellbutrin or bupropion mainly acts on dopamine and norepinephrine reuptake in the brain. And so, Wellbutrin is a little bit of a unique antidepressant. It is used mainly to treat depression. It can be used to treat smoking cessation, as well as kind of off-label use for attention deficit disorder. So when we consider using it for anxiety, it's kind of what we consider to be kind of a tertiary option. It's kind of a mixed bag in terms of treating anxiety. Sometimes Wellbutrin can actually worsen anxiety. So it's not a commonly prescribed antidepressant to actually treat anxiety. That being said, some patients might benefit from Wellbutrin to treat their anxiety. Typically, patients are treated with SSRI antidepressants or other medications that affect serotonin, like Buspar. Other medications that typically kind of lower the physiological fear response in the body, like medications such as propranolol or clonidine, which are blood pressure medications, or gabapentin, which are kind of a little bit more calming medications. These are typically used to treat anxiety first. But in cases where certain medications that are typically used to treat anxiety fail, it may be reasonable to try Wellbutrin. But you have to understand that there are some risks that could worsen the anxiety. Because Wellbutrin is a very activating antidepressant, sometimes it can cause people to have palpitations, it can cause them to sweat, it can cause them to have trouble sleeping. And this is mainly because of the action on norepinephrine and dopamine, which are very activating neurotransmitters in the brain. So, it's just helpful to understand that Wellbutrin, while in certain patients it may help treat their anxiety, it's a little bit of a double-edged sword for certain patients, and so that's something to just consider. If you'd like to learn more and read a little bit more about Wellbutrin and if it's a potential option to treat your anxiety condition, whether that's generalized anxiety disorder or panic disorder or other anxiety conditions, you can read more about it on our blog at telepsychiatry.com. Thank you.